Hello, I'm Dr. Eric Green, the Program Director for the Internal Medicine Residency at Mercy Catholic Medical Center. In this video, we're going to discuss the academics and scholarly activity of our residency. Mercy is an academic-heavy community teaching hospital. Our hospital hosts 4 separate, fully accredited residencies: internal medicine, transitional year, general surgery, and diagnostic radiology. Between those residents and visiting residents from other local health systems, there's more than 100 residents rotating through our hospital at any given time. We are closely affiliated with 2 local medical schools, Drexel University College of Medicine and Philadelphia College of Osteopathic Medicine. Those schools send us multiple students, 40 to 50 at any given time, and our internal medicine teams will typically have 1 to 2 students rotating at any given time. Most importantly, we are a resident-focused hospital. We have no fellowships and no fellows, so that all of our graduate medical education is directed at you, our residents. Our faculty is made up of clinicians, educators, who have decided to devote their time and energy and career to working in a community teaching hospital. They're here because they want to have the close connections with you. They're here because they want to impart their knowledge. They're here because this is where they want to be. Mercy has a long tradition of osteopathic medical education. Up until a few years ago, we had a separate but very closely integrated osteopathic internal medicine residency. In fact, it was so closely integrated that our faculty rarely knew which of our physicians was in which residency. Currently, we are a single residency with osteopathic recognition. For our osteopathic trainees, we integrate OMT into patient care and expect our osteopathic graduates to be integral educators for our osteopathic students. We have didactics, both local and with our osteopathic medical school partner, and incorporate distance learning and standardized assessments for osteopathic manipulative medicine. Between our traditional academics and our osteopathic focused excellence, our residents are well prepared both for clinical practice and for the board exams that are an inevitable consequence of completing an internal medicine residency. Our ABIM pass rate usually ranges in the 92 to 94% range for first-time test takers, while our osteopathic pass rate is 100%. This doesn't just happen. We spend time and energy both in formal didactic education as well as in our patient-centered education, making sure our residents know not just how to care for the patient in front of them, but how to use this knowledge and generalize this knowledge so that they'll be successful both in future patients and standardized assessments. Our residents go on to a number of different practice settings. About half will go on to become hospitalists and another 10% primary care general internists. Those residents who go on directly to independent practice find themselves practicing in a variety of different settings, from rural primary care sites to hospitalists in tertiary or quaternary centers. Regardless of where they go, they report that they feel well trained compared to their peers because of the clinical learning environment at Mercy. The remainder of our residents go on to pursue subspecialty fellowship. Those that do pursue fellowship find great success, matching out outstanding programs throughout the United States. Most importantly, you'll see there's some fellowships on this list who have accepted multiple residents in successive years, attesting not just to the excellence of their residents, but to the educational milieu that helped make them who they are. Scholarship is an important part of medicine, and we have integrated it into our training. We have a scholarly requirement, but recognize that scholarship does mean different things to different people. Our residents are asked to produce 2 works over 3 years that are disseminated beyond the 4 walls of Mercy. These can be case reports, reports of quality improvement, or individual research. Most importantly, we recognize that scholarship involves education, so one of these two projects must be as a mentee with a more senior resident teaching the process, while the second must be as a mentor, where the resident repeats the process. Despite the COVID-19 pandemic, our residents remain academically productive. Over the past 3 years, they've presented more than 50 abstracts. 37 residents have presented at 10 different national meetings, and 35 of those presentations were oral presentations. We are confident that with the gradual receding of the COVID-19 pandemic and resumption of more conference activity, our residents' academic productivity will bounce back to its pre-pandemic level. We hope that you'll explore the rest of our website and learn more about the different aspects of our residency. Thanks so much for listening today.